Well, today marks 1 month until Indiana's new abortion restrictions take effect. And already, Chicago abortion care providers are seeing an increase in people crossing state lines for help. Rachel Kraus talked with one doctor concerned for pregnant Hoosiers facing dangerous health complications.
In women with high-risk pregnancies, if we are not able to protect women to control the destinies of their own bodies, to control their fates, then there's no doubt that lives will be lost.
Dr. Susan Gerber with Northwestern Medicine says Chicago's healthcare providers are already finding themselves a destination for women in high-risk pregnancies. Some seeking abortion care their state may no longer allow. Others because their physician doesn't feel safe offering it.
These are desired pregnancies. These are women who want to be mothers, but they also don't want to die, and they don't want to orphan the children they already have at home.
In maternal fetal medicine, they see high-risk pregnancies every day, including women whose medical history may mean a life-threatening pregnancy, and now face heartbreaking choices.
They're devastating, and they're really difficult for patients. These are not decisions that anyone makes lightly, and these are decisions that are made carefully and with thought. And again, this is something that these laws and rules take away from women, is the ability to really give careful consideration to the decisions that they're making because of the time constraints.
She says when Roe was overturned, providers in Illinois began preparing for the likelihood that women would be traveling from out of state in need of abortion care.
There have been discussions taking place among the leaders in the complex family planning community for months now anticipating this, but it's the services that we have already been providing. Our team is ready, willing, and able to absorb all patients coming needing help.
Dr. Gerber says here in Chicago, they're not just getting calls from women around the Midwest, but all around the country. People dealing with high-risk pregnancies, seeking life-saving care.
We're also getting phone calls from educators in other states where there are trainees learning to be OBGYN physicians who are now unable to get that training in the states where they're working. And so we're getting requests for trainees to come work with us and train with us.
And while Illinois' neighbors continue to restrict abortion care access, Chicago healthcare providers like Gerber say they'll be here, ready to help and offer life-saving care, serving as a port in this growing healthcare storm.
Until things change and until protections are returned to women in this country, I think the city of Chicago and the providers in the city of Chicago are going to play a vital role in protecting the health of women in the Midwest.
And we remind you that Indiana's new abortion ban only has exceptions for cases of rape, incest, if the mother's health is at risk, or if the fetus has certain anomalies. And physicians can lose their license if they perform an illegal abortion. The law takes effect September 15th.